And welcome to Getting Started on Your Pre-Health Track workshop for medicine, dental, optometry, pharmacy, podiatry, and veterinary tracks. Today, we're going to talk about the academic requirements, prerequisites, GPA, test requirements, etc., for each of these pre-health tracks. So getting started, looking at the prerequisite coursework, you will notice for medicine and dentistry, it's the same, right? So generally, we're going to need 2 semesters of general biology. For us here, that's going to be Bio 151 and 152. You'll need 2 semesters of general chemistry, which will be Chem 120A and 120B. 2 semesters of organic chemistry, which will be Chem 301A and the 306A for the lab, and that second semester of lecture 301B. 1 semester of biochemistry, which is Chem 421, 2 semesters of general physics, Physics 211 and 212 with their respective labs. For statistics, our elementary stats, the Math 120 will meet this requirement, or also any major courses that you might take. So if you are a kines or a public health major and you're taking that 349 course, that's going to count in here as well. For our non-science, usually a Psych 101 and a Soc 101 is what's required. Now, there are also commonly recommended courses. So the most common that we see are microbiology. So you can do our 302 and 302 lab, anatomy, and physiology. We have a few ways you can do the anatomy and physiology. We do have an upper division Bio 361 anatomy course, which meets requirements for the biological sciences major. Or you can choose to do our lower division integrated anatomy and physiology, the Kines 191A and 191B. If you choose this track, you do need to do both semesters in order to earn credit for both anatomy and physiology. You can also opt to take one of our standalone physiology courses. Our Bio 362 meets requirements for the biological sciences major. Bio 310 and the 310 lab. This does meet requirements for prerequisites, but it does not count towards the biological sciences major. So any combination of that coursework is going to be totally fine for both of these tracks. Now looking at optometry and pharmacy, we'll see still a lot of overlap, but some slight variations. So for both of these, we still have Gen Bio, Gen Chem. For optometry, we only really see 1 semester of OChem, but a semester of biochemistry is also typically required. Now, if you're taking those courses here, in order to take our biochem course, you do need a second semester of OChem. So while it's not explicitly stated here, just by virtue of needing to take that biochem course, you are looking at doing 2 semesters of organic chemistry. Now here we usually see a semester of microbiology actually required. You can do our upper division one, like I pointed out in the previous slide, 302 or 302 lab. You can also do our lower division, Bio 202. You will also need, and this is where the exception with that 191A, the integrated courses, you need a semester of either physiology or anatomy or a combined course. So here, any 1 semester of any of our anatomy or physiology options is fine. This is the only one that requires anatomy or physiology that does not require you to do both semesters because it only requires 1 semester of either or combined of both. We also usually see calculus required here. So for us, we have 2 calculus courses you can take that will meet this requirement, the Math 130 or 150A. For stats, it's the same as the others. And then here, we don't usually see a Soc required, but that Psychology 101 is still in there. Now for pharmacy, almost the exact same, right? Gen Bio, Gen Chem, OChem, Biochem, Gen Physics. However, here we do usually see calculus explicitly required in addition to statistics. So again, that Math 130 or 150. And in addition to the Psych 101 and Soc 101 that we see with medicine, they do typically also require an economics course. This can be macro, this can be micro. Either one is fine, but we do usually see that as an additional requirement for pharmacy. And then the same requirements for that recommended coursework. Again, not a requirement, but we commonly see this, recommended to take by programs. Lastly, for podiatry and veterinary, podiatry is the same as medicine, two Gen Bio, two Gen Chem, two OChem, one Biochem, two General Physics, usually a stats, and then your Psych 101 and Social 101, again with that microanatomy and physio as commonly recommended courses. For veterinary, again, we do our, two Gen Bio, the chemistry up through biochemistry. We're looking at a physics and a stats, as well as a Psych 101 and Social 101. However, this is the one pathway that usually explicitly requires genetics. So ours for us here, that would be Bio 251. And then here, usually it's physiology that's required. And interestingly enough, most vet programs don't actually require this to be or animal physiology. You can do human physiology. So again, our Bio 362 or 310 course is totally fine. You can also opt to take our comparative animal physiology course, which is that Bio 468. Okay, so we talked about, what the prerequisite coursework is for each of these pathways. But a lot of these prereq courses have prereqs to themselves, right? We got prereqs to prereqs. So I want to go over those and then we'll look at, some pathway course sequences on how to get started taking these prereqs. So for our Gen Chem series, that Chem 120A, before you can take that course, you do first need to take either Chem 115, which is our Chem Fundamentals course, or pass the chemistry placement exam. Now, I always recommend students be very honest about your chemistry skill level, right? That Chem 115 is designed to give you the foundation you need to not just go on to Gen Chem, but to do well enough in Gen Chem that you're prepared to go on to OChem and Biochem, right? Um, Now, if you, let's say, accidentally enrolled in Chem 100, right, thinking that that was the, beginning path into chemistry and you're doing really well in it, right, then that might be a good case to take the chemistry placement exam. Or if you like recently took the AP test in high school and you did well in it, right? But otherwise, I would really encourage students to consider starting with that Chem 115 and not pushing forward, so that you are setting the foundation you need, not just to do well in the classes, but to really learn the information. So for our upper division, micro anatomy and physio courses, you are going to need to have your second semester of chemistry as well as a genetics course prior to taking those. For our genetics course, the 251, you'll need both semesters of Gen Bio as well as the first semester of general chemistry. If you're doing our lower division anatomy physiology series, the requirement there is a 3.0 GPA and 30 units on your transcript at the time of registration. So if you know, this is going to be your second semester, spring semester, freshman year, at the end of that semester, you're going to have 30 units, but you're registering, before those 30 units have officially been earned, right? You don't have grades in those courses. Then you're not going to be able to register for that KNES 191A yet. Those 30 units have to be reflected on your transcript at the time of registration. For our Physics 211, this is a calculus-based physics. For the majority of these pathways, and schools within these pathways, they don't explicitly require calculus-based physics. You can go to a local community college and take an algebra-based or a trig-based physics, but if you are going to take them here, you have to take physics. Sorry, calculus. If you're going to take physics here, you have to take calculus. So those calculus courses are going to be, again, the Math 130 or 150A. If you choose to do Math 130, which is my recommendation for most students on a life sciences pathway, you can choose a prerequisite from either taking Math 115, which is college algebra, or Math 125, which is pre-calculus. If you choose to do the Math 150A pathway, you do need to take the pre-calc course. So if we're just starting off, I like to think of these courses as sequences. I like to think of it as, where am I in my chem sequence? Where am I in my bio sequence? Where am I in my physics sequence, right? So for the chem, if we are on a track that's going all the way up through biochem, which most of these are, you're going to start with that Chem 115, right? Or in, specific cases, maybe the chem placement exam. Move on to 120A, then 120B, then OChem 1, OChem 2, and Biochem. So you can see this is going to be 6 semesters of chemistry. Because of this, because this is the longest sequence, I recommend when you're first starting out, the first semester you're starting out your prereqs, to really focus on trying to get that Chem 115 so that you can start through this. Another note is that most of these chem courses are offered during the summer. However, they are offered, they're 5-unit courses, the 120A, 120B, and the combination of 301A and 306A. All of those are going to be equivalent to 5 units, and they're done in 5 weeks. So just know, right, if you're opting to do that, just know what you're taking on in terms of time requirement for those summer courses. All right, looking at our bio sequence, bio 151 and 152, a note about those, they're actually not sequential, which means you can take bio 152 first or bio 151. Doesn't matter which one you do first, but you can't do them together. So it will regardless be a 2-semester sequence. Once you've done those and your Chem 120A, then you can move on to your genetics. Once you've done your genetics and your Chem 120B, you can move on to your microbiome, anatomy, or physiology at that upper division level. And then looking at our physics sequence, again, starting with that college algebra or pre-calc, going on to our calculus, and then your physics 211 and the lab, physics 212 and the lab, right? So this is kind of how to think through. There's some obviously overlap in prereqs between, the chemistry and the upper division bio. But I think it's really helpful to think through looking at, the progression of each of these courses and kind of keep track of where you are in each sequence as you're trying to plan this out. And some final notes on prerequisites. Anything that is a 100 or a 200 level course can be taken at a community college, but just something to keep in mind, some schools do limit the number of community college credits you can bring in. And generally, I would say, if you're doing some community college credits, you do want a mix of some at community college and higher ed. So you could, let's say, like decide to do your chemistry sequence at a community college, but do your bio and physics here, right? Or you could do your chem and bio here and do your physics at a community college, right? So in general, you want kind of like a mix of those. Another thing is you cannot do any online labs. So a hybrid course where the lecture is online, but the lab is in person is totally fine. But if both that lecture and that lab are going to be online, that will not meet requirements. For us, this is particularly of concern with the Bio 151 course. A lot of those times sections are offered online. If they are, again, lecture and lab are online, that's not going to meet your requirement. You do not want to register for that section. Also, a note on our organic chemistry. I get asked by a lot of students, why don't I have to do the second semester of OChem lab? The reason is because of unit counts, because our lab is a 2-unit lab. Between the two 3-unit semester or 3-unit lectures and the 1 2-unit lab, you're meeting the 8-semester units required for organic chemistry. So that's why we only do the 1 semester of lab. And finally, just a note that for students outside of the NSN, the College of Natural Sciences and Mathematics, majors, typically registration for chemistry and bio courses is held for majors only until, a later date. So if you are wondering what that date is going to be for the upcoming semester, you can always reach out to the biological sciences or the chemistry department for more information on that. Now, if you, again, are outside of the College of Natural Sciences and Mathematics, you'll probably notice there's not a ton of overlap with your major courses and these prerequisites. However, there are places to fit them into your GE pattern. So particularly with your quantitative reasoning course, right? If we are doing, a physics series, this is where I'd recommend using Math 115, that college algebra in here. If you're not, going up through physics, then Math 120, a statistics is totally fine to put in here. For your social sciences, that Psych 101 and Social 101 are going to fall into that area. And for your upper division quantitative reasoning, let's say you did do the physics path, so you're doing Math 115 for your lower division requirement, the upper division 2U, 5U, the Math 338 or Social 303 will also meet statistics requirements. If you're in a major that has a statistics course, this is usually where it falls to, is in this upper division quantitative reasoning. Now, the majority, like the major place where these fall in the GE pattern are with our physical and life sciences. So in that physical sciences category, the Chem 120A, In the life sciences, your Bio 151 will meet that. And then for the lab from both of those courses include a lab. And so the labs from those will meet that 5C requirement. So this is just a way, if you've already filled these, don't worry about it. It's not the end of the world. But if you haven't yet, it's a good idea to kind of try to reserve these GE spaces for these courses to reduce the overall number of courses you're having to take. All right, so in addition to those prerequisite courses, there are just some other academic components to consider. A main one of this is GPA. The minimum requirement is going to be a 3.0 cumulative and your prerequisite or science and math GPA. Um, Now, I think it's important to remember that 3.0 is the minimum, right? If you have a really strong application outside of your academics, right? If you've got like really good clinical hours, really great extracurriculars, right? I have seen, around a 3.5, make a competitive application. But I would say a general guideline would be around a 3.7 or higher. Now, let's say you took a lot of classes in high school, didn't realize they'd come in, right, for your cumulative GPA once you started college. Maybe we didn't, do as well in them as we maybe could have if we'd known that, and we're sitting at a lower cumulative GPA. If you have a high GPA in your prereqs, if you have a high GPA in your last 60 units, admissions committees can, take that into account. They tend to look at the last 60 units to assess your academic trend, right? Did you struggle in the beginning, but you've been doing really well recently after maybe you've, found the ways, to study for these classes that works best for you. You started accessing resources like supplemental instruction, right? Um, so those last 60 can help affect a lower cumulative GPA. Same goes for, a stronger test score. So again, if you have a low cumulative GPA, even if you have like a lower prereq GPA, but you do really well on one of these tests, that can also kind of help impact it, right? So, talking about the tests, academic, this is going to be, your MCAT for MD, DO, podiatry, and some optometry programs, DAT for dental, the OAT specifically for optometry, and then the GRE would be, some pharmacy programs are still requiring it, but for the most part, pharmacy does not require any kind of like academic standardized test. Regardless, across the board, we do generally recommend studying for 4 to 6 months for each of these tests, allotting about 6 to 8 hours per week, right? So this is basically going to be like taking a course. At a minimum, I really recommend getting a book. The reason being, you know, just as much as having and understanding the content on the course is understanding what the test is going to be like. Yeah, right. What the structure is going to be, strategies for taking it. That mental component of taking the test is almost just as much as the content itself. Now, the other tests we're seeing become more and more popular are the situational judgment tests or SJTs. The two main ones right now are Casper and AAMC Preview. These are designed to assess how you would behave in very specific situations. So if you have heard about, the MMI format for interviewing, multiple mini interviews, it's the same thing, right? You're getting scenarios, right? And being asked to, tell what you would do in them, right? Walk through them. So right now we're currently seeing them mainly used by medical and dental programs, but adoption amongst those programs is growing. So I think we can definitely expect to see wider adoption of these, on the horizon. The best way to prepare for these, again, there's no content knowledge to prepare for. So the best way to prepare is, making sure that you're taking practice tests, making sure that you're researching what the format is going to be for your these are still fairly new tests. They're still tweaking them a little bit. So make sure that you are, just staying up to date on what the format's going to be. And then I would say also practicing your response formats to MMI interview questions, because again, it's a similar format. And last but not least, everything that we went over today with the prereqs, right, common coursework, et cetera, that's all general, right? If you do that, you're generally going to meet most requirements. But each program is unique, right? Some might require less, some might require more, some might require the same, but like more specific. So I usually recommend by the end of your second year, and if you're beyond that, that's fine, right? But just kind of start doing it as soon as possible. Get together a list of courses or sorry, programs that you're thinking you might want to apply to. And be sure to, note what the prereqs specifically are, when our applications due, when do you have to have coursework done by, right? So note those specific requirements for each individual program to make sure that you are, on track, right? And there's not anything additional that you might want to add into your academic plan. That is all for talking about the academic requirements on your pre-health track. If you are interested in learning more about clinical hours, extracurriculars, or the application process and timeline, please check out our other workshops, which are listed on the same page where you found this one. Thank you.